Good morning. I want to thank everybody for joining us. We're going to wait a few minutes here and let people join, and we will get started in probably just a couple more minutes. Thank you. All right, it is, I believe, 11:01 Eastern time, and so we'll go ahead and get started. I know we've still got a couple, looks like maybe a few more people joining us here, but we'll go ahead and kind of get into today's conversation. Today, we're joined by Chris McGovern. He's the Director of Research Development for Connected Nation. Chris, thanks for joining us.
Hey, thanks for having me, Wes. Appreciate it.
Yeah, it's good to have you on. Chris has been with Connected Nation for many years, almost as long as I have. But we haven't had, I don't think we've had Chris on this webinar series. If you've been engaged with any of the other Connected Nation Michigan telehealth work, you've probably seen his name or even heard him speak on some of the things that have been going on. But I thought it might be good as a part of this webinar series to bring him on, have a little bit of a conversation about kind of where we're at in telehealth research for the state, and just kind of pick his brain a little bit. So certainly today, drop questions in the Q&A box at the bottom of your screen. I'll be monitoring that and trying to ask Chris those questions as we move through the webinar today. With that, Chris, a bit of a icebreaker. I know I've known you for a long time, and so I know that you're a board game connoisseur, but at this time of the year, what might our guests find you doing away from work or away from your desk? Do you get away, or do you just stick to the board games?
Yeah, every season is board game season around here, but no, with the weather warming up, and my wife and I, we just got our second vaccines, and so we're looking forward to getting out more, traveling a little bit, playing in the garden, enjoying the warm weather a little bit more than we have in the past.
I think a lot of us are in that kind of same situation where we're starting. We've either had our vaccines, starting to get them, and looking forward to the opportunity maybe to get out a little bit more than we have over the past year or so. Chris, Connected Nation Michigan completed a telehealth study last year for, I think it was 5 rural communities in Michigan. Would you mind to explain a little bit of that study, kind of set us up for the conversation today?
Sure. So Connected Nation Michigan, we partnered with AARP in an effort that was supported and funded by the Michigan Health Endowment Fund. And we wanted to look at telehealth usage, particularly in rural portions of the state. We wanted to do this on both a supply and demand outlook, where we spent time interviewing households in 5 rural counties scattered across the state. It was Gladwin, Sanilac, Roscommon, Osceola, and Dickinson was the fifth county. And we interviewed heads of households in those counties, asking them about their telehealth usage and if they had used different telehealth applications, how they had used it, what kinds of things they've done online. If they had not, we wanted to know what kinds of things were preventing them from doing so. And so we wanted to look at the demand side amongst households, as well as the supply side, which would be from healthcare providers. And that's where we interviewed healthcare providers in different facilities within those areas that were at different stages of their telehealth programs. Some of them had award-winning established programs. Others were just sort of stepping into the process, kind of more in the early stages. And so we wanted to talk to them as well about their experience, what types of issues they've seen, both from their providers that worked with the system, as well as those that, as well as their patients. What things were people liking, which things were people tolerating, what kind of benefits and what kind of challenges they were facing in implementing telehealth services. And so we did that over the course of several months in 2019, and it culminated in a report that came out in early 2020, just about the time that the COVID-19 pandemic was really ramping up here in the US. And so at that point, because it was so difficult to see a doctor in person, to get out, that telehealth really took on a much greater importance and much greater prominence. And so it was, it really came out at a momentous time.
Yeah, Chris, there were, I'm sure you can point to some things, but I'm curious, especially for all of us now that we have the past, or the experience of the past year. And you were right, we kind of, that came out just as the pandemic started to really impact the U.S. I think we've all got our own experiences over the past year that would kind of point us towards where telehealth is maybe headed, or we have our own perspectives of it. But what are some of the high points from what we saw in that study that was conducted in 2019 and released in 2020? What are some of those high points? And then, here in just a bit, we can kind of talk about what we think we might see. What are some of the changes that we might see in the follow-on study that's going on?
Sure. Some of the big things that we saw is that, like we would expect in a rural community, that the lack of good broadband connectivity really presents a barrier, both on the household side as well as for the physician side. Where the facilities where we interviewed folks, they are, they're spread out across the state. There are differences in their employment factors, in a variety of socioeconomic elements, but they had several stories in common. And one of them was that challenge presented by a lack of good broadband, because there's the obvious challenge if a person is at home and they don't have good all the time high-speed internet service. it's going to present challenges in reaching out and trying to get hold of a healthcare provider. But the providers themselves face challenges in that they have invested millions of dollars in getting networks set up within their facilities, within the like the hospitals or the clinics. But if the connection from the clinic to a consulting physician or to somebody who's providing additional insights at another facility, if those connections are bad, then it doesn't matter how good the service is within the healthcare facility. They're not going to be able to get that assistance from the technical experts or from the folks who are presenting in larger cities. And so, the lack of broadband is certainly an issue. And the other thing that we saw was that data security is something that's big on everybody's mind. Healthcare providers are doing their utmost to protect that information that they're getting from their patients, because obviously it's pretty sensitive information that they're getting. On the other hand, with patients, people who have said that they didn't use telehealth services, that was really the main reason why they said they weren't, is because they were concerned that something might happen to their data. It might get accidentally shared. It might get, they feared any number of things could happen to it, once it goes out into the cloud. And so that was one of the biggest concerns that we saw amongst people that weren't using telehealth options. For those who were, though, people seem to be very satisfied with the services that they receive, and they were, they saved time. Many people said that they saved money, though that was a little bit of an issue in terms of, whether like insurance or Medicaid or Medicare would cover those telehealth services. But there was discussion of saving time, saving money. Overall, about 2 out of 5 people with whom we spoke said that they considered the treatment that they received through telehealth to be either comparable to an in-person visit, or that they actually preferred telehealth visits over going in person. And so, the majority was still preferred an in-person visit a lot of times, but a relatively large share of people did say that when they did use those telehealth options, that they were pleased with the results.
Yeah, Chris, and that kind of leads us into, since the release of that report, and I put the link to some of those resources in the chat box for any of the participants that want to take a look at that haven't. But since the release of that, we've had a pandemic. And as a part of the work that we were doing, we were going to have kind of follow-on meetings in these communities and really kind of dig in. And obviously, based on what happened with the pandemic, we were unable to be in person and meeting and talking and really kind of digging in. And so, I guess, gosh, it's 2 weeks ago today, we had a telehealth summit that kind of was a culmination of a lot of the conversations. And really what we did was, we were able to bring, number one, Lieutenant Governor Gilchrist was able to speak. on all things broadband and telehealth in Michigan. I myself was able to moderate a panel of guests to talk specifically about the connectivity side, the broadband side of telehealth. And then Jessica Denson, our director of communications at Connected Nation, she led a panel really talking more specifically on telehealth and some of the things that we've seen. And so, Chris, is there, could you talk a little bit about, what the process has been as we kind of lead into this follow-on study that we're working on right now?
Sure. So the research that we did, it was a jumping off point. Essentially, our goal was to help communities address and close those telehealth gaps. And so, this study was an initial data gathering effort. We wanted to make sure that we were identifying the right issues before we jumped in and tried to help with things. So once we had this information, the next step was one that was more follow through, where we were working to share the information and working with healthcare providers to help address some of the issues that they were seeing or that were identified in this study. Some of them ended up being addressed because of the changes due to COVID. One of the big issues that we heard from healthcare providers was that differences in reimbursement rates, or the ability to get reimbursed at all for a lot of telehealth services was a real barrier to their expanding their offerings, because Medicaid, Medicare, there were a lot of services that they couldn't, their healthcare providers couldn't get reimbursed either at all or at the same rate as they could for an in-person visit. And so this ended up in really created an incentive to lean away from telehealth and more toward in-person visitation. But one of the things that changed with COVID is that those restrictions in many areas have been reduced or eliminated at this point. And so it makes it much easier for providers to get reimbursed at similar rates, both from public payment options as well as through private insurance. But it makes it a lot easier to access or to get reimbursed at a comparable rate. And so, there are some issues like that got remedied, and hopefully that will remain the case once things have calmed down a little bit from the coronavirus. But other issues like helping healthcare providers address the concerns of consumers in their data safety, and helping them get the word out about the services that they offer online. The phase 2 of our telehealth project was to help address the issues that we identified in our initial research effort. Now, stage 2.5, 3-ish, the next step is that we want to look at changes that have occurred in telehealth usage over the last 2 years. And so, part of that is going to be asking some very similar questions to what we did in 2019, so that we could attempt to get some trend data. That was the original plan 2 years ago, pre-COVID. But obviously, the coronavirus has wreaked havoc in so many parts of our lives that simply asking about telehealth usage now versus 2 years ago, it wouldn't tell the full story. So we're incorporating some questions about how much of an effect the coronavirus had on the decision to use telehealth applications. What types of services people are using now versus pre-COVID, and how much of that decision was made as a result of concerns about the coronavirus. The data collection that we're doing now is it's going to be a little bit of trending information, but I think it's also going to give a healthy amount of insight into whether or how much COVID has affected the use of telehealth applications.
Yeah, Chris, and I think that gets into this idea of some predictions or expectations, and I think you bring up a good point that it would probably be unfair to try to compare it directly to the 2019 results that were collected, because as we've heard and discussed, so many healthcare providers and just the general populace was forced into the use of telehealth services, right? Chris Kitchen isn't on here, but he's with Munson Healthcare, and we've had several conversations with Munson and what they did during the pandemic. He was one of the panelists on the panel that I was with last week or week before last. I apologize. And he talked about just how quickly they had to spin up. From going from, I believe it was a 3-year plan to basically deploying that 3-year plan in a matter of a month or two, and kind of having to just throw it all out there. And so some of those concerns that you addressed were certainly things that they were concerned with, that they were had to deal with, the data privacy, obviously, and then seeing how they could ensure that they had the appropriate facilities or that the appropriate connectivity existed where they needed to be able to provide those services. And so, I've even heard Chris talk about, now as they, everybody starts to pull back a little bit and think about the things that happened in the past year. There were, temporary provisions made to allow things to be, basically fast tracked and put in place that would have, in times previous to that would have taken much longer to get approval to put in play. How much of that gets kind of pulled back a little bit? What's the evaluation that takes place now on both service, the service as well as the customer or the consumer patient care side of it as well. And so I guess with that, are there additional predictions, things that you expect will really stand out? Are there any of those? Are there potential things that you think maybe can be compared 1-to-1 from the previous data?
Oh, sure. And going back to the point you were just making, to kind of piggyback off of it, in a lot of ways, rural healthcare providers in the state, they were able to respond so quickly and really get ahead of some of the demand side issues because of their flexibility. That was something that was brought up back in 2019, where folks talked about how they're, the smaller clinics or some of the more remote clinics, they were able to respond faster because, just by being smaller, they were able to be a bit more nimble in their policies, and so that, because of that flexibility, that they were able to, rural clinics or rural healthcare providers were able to respond in some cases a lot faster to change than some of the bigger facilities. And and that holds true both in the in the single facilities, like like a single GP in his office, versus smaller clinics that are satellites of larger networks, healthcare networks. When I saw that there was a question that was posed about looking at clinics to their parent company versus individual clinics, and what we found was that there was different facilities, different clinics like that, where they were putting a lot of money into improving their networks at the time, and those networks, whether they some of them were in-house, some of them were wide area networks, and those investments really pay off within the facility, within the institute. But there are times when the ability to connect to a facility in another county or to a different facility going through the public or through the internet, that ability got challenged a lot of times because of the state of rural broadband in a lot of remote areas. Not all areas, but in several of them. In terms of making comparisons, I think that, like I said, COVID has obviously affected every element of our lives practically. And so there are going to be a lot of issues that are going to be identified and researched for years to come, both in terms of healthcare offerings and the efficacy of the types of services that are being offered now compared to a few years ago in terms of telehealth, as well as within the policy realm. The Medicaid, Medicare, all of these things have gone through some very dramatic shifts in a very short period of time. Advocates for telehealth have been trying for years to help get more equitable reimbursement for telehealth services compared to in-person. And there was very little movement in that prior to COVID, and now in a matter of months, those agencies made some huge changes, and it is possible that that they can go back. They can take some steps back. Hopefully not, but there's going to be a lot of investigation, I think, into what kind of impacts, both positive and negative, are coming about because of this expansion of telehealth services and the ability to get it paid for um, in a much more equitable fashion than it was in the past. So I think that's, oh, please.
No, I was going to say, Chris, that seems to be the theme that I've heard in state and elsewhere. That at this point, it's just a matter of being able to take to kind of step back a little bit as some of the urgency it has at least slowed down. Being able to step back and look at some of the things that have taken place over the year, and not necessarily to try to go backwards from where we came from, but to say, does the policy, how do we adjust the policy to again continue to protect and make sure that we're doing what's best for the patient and these health systems, and getting them the care that's really needed. And what's funny is that we focused so much a year ago. We focused on this because we saw that telehealth was something that could be good for rural communities, that it has a good impact for rural communities, from a lot of different areas, but certainly on just the general health of that community. And today, a year, over a year later, we're looking at it as an absolute need, because this helps us manage health in a way that just wasn't possible even a year ago in so many cases. And so, having it now is no longer this would be good for the community, but this is an essential service within the community. And how do we entertain and really enable that in our rural communities? And so we've had a lot of conversations, again, with even with the rural healthcare providers, but we've talked with broadband providers, and one of the things that kind of comes out of that we've seen or had conversations about is how those sometimes the healthcare systems or our healthcare providers are now becoming an active participant in this conversation about how to bring greater connectivity to a community, right? Which is just a totally different conversation that we would have had a year ago or a year and a half ago, as they now see themselves as a much more important part of that overall puzzle for our rural communities. I think you were going to add something else. I apologize for cutting you off there. Something else you wanted to add, Chris?
Oh, no. I was just going to say that, in a lot of spheres, whether we're talking telehealth, obviously with Connected Nation, we're interested in expanding broadband across the board for a number of issues. And so, whether we're looking at telehealth or online education or working from home, in a number of spheres, one of the things that has resulted from our response to the COVID is that broadband has really been put in the spotlight for a lot of people. Whereas some people or some communities in the past may have seen better broadband service as something nice, but not a priority. It has really been prioritized in a number of spheres since 2019. And so if that spotlight can remain focused on it, on broadband expansion and broadband availability as well as adoption, that's going to be something that can really make a change for rural communities across the country.
Yeah, and Chris, and I guess a couple things here. If you have additional questions, please go ahead and drop those in. We're going to kind of start wrapping up here. Chris, I know there's another question I want to get to, but I also want to give you the chance. Is there anything else that we maybe haven't touched on that you'd like to?
Well, I think that this is going to be like I said, this is really a momentous time for our country. And there are going to be a lot of opportunities for us to change as as we look at expanding broadband, expanding telehealth access and usage. It's going to be important to to have good information to direct those changes and provide insights into the best, most responsible way to go about making those changes. So I'm hoping that this research that we have been doing, that we're in the process of doing now, is really going to help provide some insights that can do that.
Yeah, and Chris, one of the things, there's a couple of questions have come in, and I would honestly kind of put those in a very similar bucket. And so one of those questions has to do with our special applications being developed to ensure security issues on a patient computer system when they log on for telehealth. And so, I know that each healthcare provider is handling, is doing things a little bit differently, but a lot of them do have, specified applications. But we also know, and this leads to the second question that came in, and the second question was, what provisions were discussed regarding education and the use of services in telehealth? Is that we know that in many cases, there is a lot of education that needs to take place for the general populace as it relates to the use of not only telehealth, but just online services in general. Chris, you manage our research, all of our research for Connected Nation. And we see this not only in telehealth, but across a broad spectrum of things. Any responses to that? Again, I know there are some, each telehealth provider kind of has their own application or has their own protocols, but certainly education and educating the general populace on how to utilize these services is going to be a very important part of what's taking place.
Oh, sure. Like I said, a lot of healthcare providers they have created their own protocols and their own applications or their own software to protect their data internally. Everything that is sent online that it involves patient data, it's going to have to be HIPAA compliant and follow the same or adhere to the same rules as as it would for an in-person visit. And so a lot of attention has been paid to that, to securing the information that both that they receive from the patient as well as anything that might be shared, like for consultation purposes, for example. So yes, that has definitely been something that has really been in the forefront of a lot of providers' minds. And in terms of education, that is definitely something that has to be taken into consideration, both from the patient as well as from the provider side. There are some relatively common telehealth applications like a video conference for a doctor's visit, for example, that is about as easy to use as what we're doing now with the Zoom tool. There are other applications though that are they're a lot more complicated, and so patients have to be educated in order to feel comfortable using it, to use the tools correctly. Things like remote monitoring tools, for example. Those kinds of things. If they're not beyond the broadband aspect, the connectivity needs. If a person doesn't know how to properly use it or apply it, those kinds of things can result in inaccurate readings or missed readings or frustration to a point where a person may just give up on it or toss it aside. So there's the education for the patients as well as for the healthcare providers, because as we've said a few times, many providers are really diving into this process just now, and so there's going to be a learning curve with some of those applications.
Yeah, and Chris, we've heard some of those some of our healthcare providers make mention of essentially being on call to answer questions, to help kind of walk patients through the use of their different tool sets and whatnot. And just a general level of education is coming along. And ultimately, as we see the public become more comfortable with these types of tools and these types of interactions, and I think this past year has probably moved that dial quite a bit, we're going to see more and more comfort level even with telehealth, because there's fear in the unknown oftentimes. I know there was another question came in too. Are there considerations for diagnostic aids such as blood pressure, heart rate, EKG? And Chris, I think that's exactly what you were talking about. And I know that in some telehealth systems, they've implemented, kind of pods and libraries and things like that where you have access to those tools. So you have to, appropriately fit a blood pressure cuff, or you may have to do those types of things. And so certainly there's additional levels of education and implementation of new tools into these systems that really do become helpful. And as we think about it in our closing here, telehealth closes the distance and makes available practitioners in our homes or at least in our community in some instances. But as we think about kind of the grander opportunity, particularly as we see rural healthcare kind of retract across the country, we've seen lots of rural health hospitals close. General practitioners, are fewer and fewer in many communities. This really begins to help us open that back up a little bit, but it opens the doors to eventually and hopefully the opportunity for us to have access to specialized care that we might not have access to even regionally or at the state level, but from across the country, and kind of closes that distance, maybe eliminates some of the travel hazards, some of the issues that you have there, and often the cost of the cost barrier that exists in being able to get from, say, the UP down to a clinic in Texas, or who knows what those opportunities are. And I say that simply as those are the opportunities that quality connectivity and the continued advancement in telehealth begin to open up for the residents of Michigan and really everybody around the world. And it's our hope that as we work locally and in a rural context, that we, number one, help maintain and expand the services that exist there, but really begin to open the doors up to new opportunities as the technology becomes more widely accepted, and as we all become more comfortable with how to fully engage with these technologies and our healthcare providers in this kind of digital world. Chris, any other comments before we close out?
No, I just want to thank you for your time. And as we've mentioned a few times, we're in the process of collecting information now, conducting the second round of surveys. And that information is going to be released probably in late summer of this year. So be on the lookout for that. And we'll be examining a lot of these issues that we've discussed today.
Chris, we thank you for joining us. Good luck with all the new research data that's coming in. We want to thank everybody who joined us and all the questions that have come through. I will send a link out to everyone as a thank you, but a link that has the recording of today's session available for all of us to go back. If you've got questions, certainly feel free to reach out to Chris or I. His contact is here as well as mine. His is C. McGovern at connectednation.org. But certainly feel free to reach out and we'll be happy to get back to you. We want to thank you, and we'll hopefully see you back in a couple of weeks for our next webinar. Have a great day.
Thank you very much.